Good evening, friends. AI diagnostics, GLP-1 advances, and mRNA oncology. Intro. Welcome to the Daily Dose for Monday, August 24, 2026. Today, a major shift in FDA guidelines for AI-driven diagnostic tools, groundbreaking Phase 3 data on a next-gen GLP-1/GIP compound for fatty liver disease, and a promising mRNA trial in pancreatic cancer. Segment 1, AI and Diagnostic Imaging Update. Asterisk headline, FDA finalizes guidance on autonomous AI imaging tools. Asterisk the news, the FDA has released finalized guidelines for AI algorithms that can detect high-priority findings, like intracranial hemorrhage or pulmonary embolism, on CT scans without initial human review, classifying them under a new regulatory pathway. Asterisk context for physicians, this aims to reduce turnaround times in emergency settings. However, it places increased pressure on system-level liability and AI training data validation. Asterisk key takeaway, AI is shifting from decision support to autonomous triage. Segment 2, Cardiometabolic News.
Headline, Phase 3 trial results, retatrutide plus superior to semaglutide in MASH, NASH.
Asterisk the news, published in the NEJM, data from the TriMASH trial shows a novel triple agonist, GLP-1/GIP/GCG, achieved significant resolution of MASH, metabolic dysfunction-associated steatohepatitis, in 65% of patients at 48 weeks, with 40% showing reduction in fibrosis stage, outperforming previous standards. Asterisk clinical implications, this provides a strong medical option for liver fibrosis reversal, potentially reducing the future need for transplantation. Asterisk key takeaway, the focus is moving beyond weight loss to direct organ-level reversal of damage in metabolic syndrome. Segment 3, Oncology Update. Asterisk headline, mRNA cancer vaccine trial shows promise in pancreatic adenocarcinoma. Asterisk the news, interim analysis of the Vaccine P trial reveals that an individualized mRNA vaccine, combined with adjuvant chemotherapy, resulted in a 40% reduction in relapse rates in resected pancreatic cancer patients compared to chemo alone. Asterisk clinical implications, pancreatic cancer has historically had poor responses to immunotherapy. This personalized approach targets neoantigens specific to the patient's tumor. Asterisk key takeaway, mRNA technology continues to disrupt traditional chemotherapy protocols. Asterisk. Quick hits and regulatory. Asterisk FDA approval, rapid approval for a new subcutaneous therapeutic for pediatric refractory epilepsy. Asterisk drug shortage alert, updated guidelines for managing ongoing shortages of essential 4 fluids in the western U.S. Outro and action items. To recap, prepare for AI-driven diagnostic tools to influence workflows, watch for the shift to triple agonist compounds for MASH, and follow the mRNA cancer trials. Thanks for tuning in. Slow down while eating. The faster you eat, the more air you swallow. Your stomach can swell when it traps the air, which sometimes passes on to your intestines. Plus, you down more food when you eat quickly. That's in part because it can take as much as 30 minutes for your stomach to tell your brain that you're full. You might overdo it before your brain gets the message, and that can also make you feel bloated. WEBM. Use with caution, red yeast rice. This supplement comes from a fungus that grows on rice. Studies show it can lower LDL cholesterol between 15% and 25%. That's because it contains a compound called monocolin K that's similar to what's found in statins, prescription medicines used to lower high cholesterol. But red yeast rice isn't regulated by the FDA, so you can't be sure its supplements contain enough monocolin K to lower LDL cholesterol. Side effects are similar to those of statins and may include stomach pain, gas, headache, and dizziness. WebMD. Zinc supplementation. Supplementation, asterisk. A randomized trial in Uganda found that daily zinc supplementation reduced infection rates among young children with sickle cell anemia, SCA, by 38%. Severe bacterial infections were cut by 2/3. Medscape. Thank you for your time. Thank you for your dedication to patient care, and we will see you right here soon. Disclaimer: compiled information. This content is for educational purposes and is not a substitute for professional advice. The audience must verify the contents before use. The creator, publisher, and YouTube will not be responsible for any harm.